Welcome to the Truth and Liberty broadcast. We believe we have a mandate to bring godly change to our nation and the world through the 7 spheres or mountains of influence. To further this cause, we give away a product every week that will empower you to get involved in changing your life and changing our world. You can register for our weekly giveaway by subscribing at truthandliberty.net. You can also subscribe to our newsletter to receive weekly updates on guests, news, and much more. This is an interactive live cast, and we welcome your questions. To ask a question during the live cast, use the comment or chat features. Now get ready to dive into this week's topics with our hosts on location in Colorado, USA.
Hello and welcome to our Monday Night Truth and Liberty live cast. We're glad that you've joined us. I'm here with Richard Harris. He's our chief counsel here for Truth and Liberty. And tonight we've got a really special guest. I saw a video, I think it was in June, of Dr. Scott Jensen, and he's also a Minnesota state senator. And it was so powerful. I told Richard, I said, we need to get him on Truth and Liberty. So it's taken us a while, but we're going to be interviewing him tonight. And I tell you what, he's got some things to say as a doctor that I think is going to add credibility to some of the questions and maybe the feelings that we've all had. But, you know, sometimes we wonder about, is this right or wrong? Anyway, you are going to be blessed. But before we do that, this is Richard Harris. He's our chief counsel, and we would like you to participate. We're going to have a section at the end of this where you will be able to ask Dr. Jensen questions, and he will be taking your questions. We've also got meetings coming up, a lot of different things.
Yeah.
So, Richard?
Thank you, Andrew. Well, yeah, what a blessing to have Dr. Jensen with us tonight. I'm looking forward to it. And just want to welcome everybody to the show tonight. It's going to be great. I wanted to mention, if you haven't checked out our website lately, I encourage you to do that, especially under the resources tab. We have more resources in there than you can even count. We have a 24/7 news feed where we pull from reliable conservative news sources, where we really are a one-stop shop when it comes to news. You only need to go there and you're going to get all the headlines from a conservative perspective. But also, you know, there's an election coming up, and we have a whole section on voting resources at truthandliberty.net. So you'll be sure to check that out. You can register to vote. You can find out who your current representative is, find voter guides, and all kinds of other things. So please be sure to check that out. I wanted to mention in particular that Andrew did a podcast recently with an organization called Million Voices, and we've got that linked on there. That's a really great talk that he gave there, so be sure to check that out. And we've got some events coming up here at Andrew Wommack Ministries. The first one coming up starts tomorrow, or isn't that right? Yeah, the 22nd. Get my name. Or Wednesday?
Thursday.
Well, the
Thursday,
values.
Friday and Saturday.
Well,
well, you're talking about a different events.
Yeah, I said here, so I got you confused. My bad. Values Voter Summit starts tomorrow. And this is actually put on by the Family Research Council, our friends there. This is normally a conference that takes place in Washington, D.C. at a fancy hotel there, and the president comes and talks, and they have all these powerful speakers. But this year they're going virtual, and I kind of think it's great because they're going to actually reach more people. But Truth and Liberty is a major sponsor, and Andrew's got a couple segments there, where I think you're interviewed by Tony Perkins, and another one where he's speaking, addressing some subjects of concern. And then there's a breakout session that Andrew does with David Barton and E.W. Jackson that addresses the whole race and riots and all this stuff that's going on.
I tell you what, it's something that every person ought to see. That it is stuff that you aren't going to hear. I've never heard anybody else say it.
Oh, it's amazing.
It'll be good.
Yeah, and to get E.W.'s perspective from, as an African-American and David's as a historian, it's just awesome.
Yeah, it's awesome.
And so you can register. You have to register to go to this virtual conference. You can do that on the Truth and Liberty website. So just go to truthandliberty.net and register, and you'll get a pass where enable you to watch all of that content. It's the 22nd through the 25th, 8 o'clock to 9:30 Eastern, 6 o'clock to 7:30 Mountain Time. Next up this weekend, we have the Identity in Christ Conference with Andrew and Dwayne Sheriff. It's right here in Woodland Park at the Charis Bible College campus, and it's going to be an awesome conference. I tell you, it's hard to imagine much more of an important subject for believers to walk in victory than knowing their identity in Christ. So it's going to be great. And then we have the Ministers Conference, October 5th through the 9th, an annual event. What is this, Andrew, the 36th year you've done this?
At least 36 years. We've been been doing it decades.
Maybe closer to 40. But Andrew and Greg Moore, Pastor Bob Yandian, Dwayne Sheriff again, Carrie Pickett, and others are going to be ministering, and it's going to be a powerful time. If you're a minister of the gospel, you need to be at this event. You'll be blessed and encouraged, and also have an opportunity to network and connect with other people. So it's going to be great. You can check that out on awmi.net. Get registered there. Every week here on Truth and Liberty, we have a product that we give away to people who subscribe to be on our website. So if you haven't subscribed, you need to do that, and then you can receive our weekly email update and newsletter, and it's free. All you have to do is go on the website, click subscribe, and fill that out. Last week, we gave away Andrew's book, A Sure Foundation, and congratulations to Rita Westwood. You are the winner of that. And then this week, we're giving away Andrew's book, Grace, The Power of the Gospel. So this is an awesome book, too, so be sure to subscribe and be eligible for this, autographed by Andrew. Andrew mentioned that you can post your questions for Dr. Jensen online on Facebook or on our website, or your comments. So be sure to do that tonight. We really want to hear from you. And then Truth and Liberty is supported by our generous members and donors. And we are a 501c4 organization, which means your contributions are not tax deductible to the IRS. But even though the IRS doesn't notice, God does. And we really appreciate your support there. If you'll become a member, all you have to do is commitment to $5 recurring gift or more per month, and we'll send out a free gift to you in the mail. And then last, I wanted to mention that if you need prayer tonight, someone to agree with you, we have Spirit-filled, Word of Faith, trained prayer ministers standing by to agree with you. All you need to do is call in 719-635-1111, and someone will agree with you in prayer. So praise the Lord. I'm looking forward to this time here with Dr. Jensen. Andrew, I'll kick it back to you.
Right before we get into that, let me just say one other thing, and that is that we did a panel discussion on July the 2nd, and it was an interview with General Boykin, Bill Federer, Tony Perkins, E.W. Jackson, and Janet Boynes, and it's a 2-hour interview. And starting on the 5th of October, I'm going to play it on my television program. And because it's so political in nature, we are paying for it from Truth and Liberty, this 501c4 organization. It cost me $350,000 a week to be on television. And so we need people to help us, because I'm not going to pay for it through the Andrew Wommack Ministries. It's coming through Truth and Liberty. So if you would do what Richard said and go to our website, you can join with us for a $5 minimum monthly withdrawal, and that would really help us in order to be able to pay for this and get this message out.
Amen.
So Dr. Jensen is also a senator from Minnesota. He was awarded, let me get this name correct, the prestigious annual stateside award, Minnesota Family Physician of the Year, and that came from the Minnesota Academy of Family Physicians. So he's been very well credentialed, but he's also a politician. And when I first came across you, Senator Jensen, is when you put something on YouTube, I think it was, back in June, because you had some complaints because you weren't following just the politically correct way of speaking of the virus. You questioned some of the things. And so would you give just a little bit of a background as to why you got in the crosshairs of some people, and the things that you said and what's happened with it?
Well, thank you very much, and I'd be glad to. It really all started right around April 1st, and it was no April Fools. On April 3rd, I received a communication from the Minnesota Department of Health, which at its simplest level seemed to be telling me how they thought I should be using COVID-19 as a diagnosis on death certificates. And some of the advice was clearly something that I'd never seen before. I've been doing death certificates for 35 years. And when we have influenza epidemics, whether it be H1N1 or a different type of flu or any type of disease that runs through the area, we've never really been coached as to how to do death certificates. But on this communication from the Department of Health, they encouraged us to go ahead and use COVID-19 as a cause of death if we thought that it was probable, or that we assumed that it was the cause, or even if it contributed. And this was in stark contrast to what normally we do, because in a death certificate, the main section is part 1, and that should represent a precise, or as precise as we can be, sequence of causation, leading from an underlying cause of death through intermediary steps to finally an immediate cause of death, whether that be respiratory distress or whatever. But in this communication, I was being told that you can go ahead and use COVID-19 here and here and here. And I just cried foul. So a few days later, I was on a TV program where we were talking about an article on the lockdown. And it was actually by chance that we started talking about this communication from the Department of Health. And that sort of got run up the flagpole, and the rest is history.
So are you saying that even if they weren't tested and if there was no diagnosis, they were encouraging you to list it as a COVID death?
Very much. In fact, the Minnesota Department of Health communication linked to a 7-page CDC document whereby CDC provided 3 scenarios of patients dying, whereby COVID-19 would be the recommended cause of death. In the third scenario, I remember very well, it was an elderly woman who'd had a major stroke 2 or 3 years earlier and was wheelchair bound. And she ended up dying. And the sort of side story was that prior to her death, she was, it sounded like she was dwindling and doing poorly. But prior to her death, evidently her son visited her, and he was later found to have COVID-19. And because he was presumably symptomatic when he saw her, and then she ended up developing a high fever and a severe cough, that would be a COVID-19 death. And quite frankly, if you look at the CDC's manual for physicians to complete death certificates, they repeatedly talk about the cause of death should represent the initiating event in a train or sequence of events that ultimately leads to a person's demise. In this situation, the patient's severe large stroke that left her wheelchair bound would have been the initiating event, I believe. And the pneumonia that she developed would not have been typical of COVID-19. It probably would have been more typical of aspiration pneumonia, where many times people with a stroke, more than 50% of them will have trouble swallowing sometimes, and sometimes aspirate pharyngeal, if you will, contents into their lungs, and they can go on to develop a relatively rapid moving pneumonia, and it can take their life. But regardless, this was something new. And so when I was on the Chris Berg Channel 4 Fargo Moorhead News a few days later, we talked about it. And then Laura Ingraham asked me to be on Fox News, and we talked about it some more. And at that time, what I really learned was how quickly a person can be targeted. It became evident that I was skeptical of the mainstream media conventional narrative. I was challenging some of it. I was saying, well, why would we have encouragement to put down COVID-19 for a cause of death when we have never done this before? We didn't do this in 2018 when there were 80,000 Americans that died of the influenza outbreak that year. And we didn't do it in 2009 with the H1N1, or in 2002 with SARS, or 2012 with MERS, or 2014 with Ebola. This was something new. And because I challenged it, I began to be criticized. I was initially attacked by bureaucrats, and then some of my fellow senators on the other side of the aisle were highly critical of me. And then the mainstream media came in, and I remember the New York Times doing an article on me on a Sunday, and it was on the front page, and it was sharply critical. And then I was criticized because I wasn't adequately controlling who on social media and the internet was using clips or videos or comments that I had made. And nobody's ever been able to share with me how it is that a person can actually control those things, because social media is a bit of a free-for-all. Yep. And I don't know how I can stop someone from taking a clip of something I say and putting it in the context of their own narrative. That's just part of where we're at these days.
So, Scott, from my perspective, it seems like science ought to be evaluating all of these different things and shouldn't be challenged by having a different viewpoint. You're talking about politics. It sounds like politics is running this instead of science.
You're exactly right. Andrew, is politics has literally taken over, and we have allowed science to be sacrificed at the altar of panic and fear. And in June, when I received notification from the Minnesota Board of Medical Practice that I was being investigated and that my license would be evaluated because I had presumably spread misinformation because I compared COVID-19 to influenza, which is exactly what Dr. Fauci and Dr. Osterholm had been doing, that was problematic. And I was also accused of giving reckless advice. And this was silly at multiple levels as well. So I had to prepare a response, and it was 5,000 words, 8 pages with 70 pages of attachments, and took about 30 to 40 hours to put it together. And I submitted that. And then about a month later, the Minnesota Board of Medical Practice sent me a letter saying that after reviewing the documents that I'd submitted and the initial allegation that the allegations were being dismissed, I was not allowed to know who my accusers were. And that was that. But then 3 weeks ago, I was notified by the Board of Medical Practice again that I have now been accused of being a danger to public health. So once again, my license and my livelihood are at risk.
That's terrible. And, based on the video that I saw back in June, part of the things that they were saying you were giving false information or something was because you basically said hydroxychloroquine was a proven drug. Your wife has even used it. I took it when I was in Vietnam. And anyway, it's got a history of decades. And because I'm not saying that you promoted it, but you didn't just say that it should not be administered. You weren't following the politically correct thing. That was part of what they came after you for. It's politically motivated.
And hydroxychloroquine is a proven drug in that it has been indicated by the FDA for inflammatory arthritis, and it has been used for malaria treatment and prevention for years. And there are a variety of connective tissue disorders that we do use hydroxychloroquine. I also said that people need to press the chill button a little bit here because the hydroxychloroquine has just gotten hammered and discussed like there's no tomorrow. And it's been on the World Health List as an essential medication for more than 60 years. So I felt like hydroxychloroquine needed to be evaluated in the medical community, not, if you will, on cable news and by politicians and bureaucrats. And that was, if you will, in sharp contrast to the conventional mainstream media. And so, yeah, I think that really did trigger people being angry with me.
So Richard and I both have friends who had a pretty severe case of COVID-19, and they got access to hydroxychloroquine, and within 2 days, both of them were up and around. And so we have, what did you call that, anecdotal information, but it's nonetheless personal testimonies that it's worked on people. Could this have actually saved some of these lives of people who died from the COVID-19?
There are experts far more committed to a narrow focus of studies such as viral illness, pharmacology, that have around the globe indicated that had hydroxychloroquine not been so restricted, that yes, people's lives could have been saved. I don't have that kind of a comfort level with the data that I would say it's been proven, but I know that multiple countries put forth small studies. Granted, they weren't double-blinded studies or randomized control trials, and no, peer review hasn't had a chance to weigh in. But the fact of the matter was, there was promising, hopeful information available. And then there were studies that came out and said that it provided no value. But many of those studies had used hydroxychloroquine relatively late in the illness. From my perspective, I still don't think we have the answers. I think we need to do more research on that. But I think one thing that people need to realize that in medical school, a lot of times we're given a certain program. And so we're taught that antibiotics kill bacteria and that antifungals kill various kinds of fungus. But we also have been taught that in terms of antivirals, there isn't a lot out there. And we have some limited, if you will, a limited palette of options for antiviral treatments. And they've grown a lot because we now can treat the zoster virus with a variety of antivirals. But the idea that an antibiotic like doxycycline might have something more than just an antibacterial effect, or an anti-inflammatory agent like hydroxychloroquine could have something more than that it might actually have an antiviral mechanism whereby it can help. These are things that we're still needing to explore, and I think the medical community needs to have that conversation. I read articles on that every week about the fact that hydroxychloroquine is not simply a typical anti-inflammatory medication. It works against a protozoan like the malaria cause, and it works against inflammation, and it is an immune modulator. So hydroxychloroquine doesn't fit into a neat little cubbyhole, but there are many anecdotal stories and data accumulations that have indicated that it could be helpful.
So, Scott, let me circle back to one of the statements that you made about you were encouraged to attribute deaths to COVID-19 when there was no proof that that was the thing. I've heard stories of people who died in car wrecks, and they put COVID-19 down as the cause of death. I heard one story here in Colorado where a man had a 0.55 blood alcohol level, which is death sentence itself, and he was attributed to COVID-19. And then I think it was, you would know this better than I do, but just a couple of weeks ago, CDC revised their death count from COVID-19 down to, I think, 9,200 cases that were strictly caused by COVID-19. What's your opinion on whether these numbers of 190,000 people in the U.S. dying from COVID-19, do you think that these are accurate, or is it overstated?
I think there's two questions embedded within what you just shared, Andrew. The first one is regarding these anecdotal stories of someone in a car accident or dying of alcohol poisoning being identified as a COVID-19. Those stories may be anecdotal, and someone might be inclined to dismiss them as being nothing but some gossip. But the fact of the matter is, we have multiple stories around the nation where states reduced their COVID-19 death count for reasons that you're stating.
That happened here in Colorado.
Pennsylvania reduced their COVID-19 death count by almost 200 because the coroner stepped in and said, no, these are not COVID-19 deaths. Colorado had some 150 to 200 COVID-19 deaths subtracted from their total. Kentucky did the same thing. New York went the other way. And because they had, if you will, a larger than expected number of deaths in a certain time frame, they said, well, they must have been COVID. So they actually added to their total 3,700 COVID-19 deaths. So that literally overnight, they went from 7,000 to 10,700. So the fact that this kind of juggling of numbers was going on is clear evidence that there's been a lot of mushiness and murkiness introduced. Now, the second question you asked about was the CDC's recent announcement regarding COVID-19 deaths. And what they came out and said, and I think it's important to understand this, but they came out and said that 6% of the COVID-19 deaths in America were, if you will, death certificates with the sole cause of death being identified as COVID-19. And the other 94% had additional diagnoses involved, whether it be congestive heart failure, colon cancer, breast cancer, pneumonia. And so what they were saying was that, and I referenced this earlier, that 94% didn't necessarily not be caused by COVID-19, but that there were approximately 2.5 additional underlying conditions for each person of that 94% bunch. And that it may well be that these were people that would have or were dying of one of these underlying conditions, or if you were on the tipping point of dying, and that the COVID-19 might have better been classified as a contributing condition rather than the cause of death. And so I think it would be unfair to say that we have 180,000 death count that should be reduced to 10,000. But I think what is fair is to acknowledge the fact that the CDC, and so many other agencies and many departments of health have so muddied the waters that in order for us to really get our hands around this, we are going to have to, as legislatures, we're going to have to call for an audit, because the number of deaths and the case counts and these kinds of things are informing public policy. And some of these public policy decisions have been draconian in nature.
Mm-hmm.
So I think that there's a very good likelihood that numbers are askew. They could be underreported in terms of cases. They could be overreported in cases of death. But I think legislatures around the country are going to have to call for audits to be done.
So let me ask you this, that I heard one report that said around 80% of all of the COVID deaths would have occurred in 2020 anyway, because they were in either older people or people had pre-existing conditions. Would you agree with that, or have you heard anything about that?
Andrew, I think you're spot on. I think that's exactly right. We know that, a couple of statistics I think that provide some context that's helpful. First off, we use nursing homes differently today than we did 15, 20 years ago. I've been medical director of numerous nursing homes, and I used to take care of patients who would be in a nursing home for 5, 10, 12 years. Today, the average length of stay, if you're being admitted to a nursing home as most likely your last domicile, you're not going there for a 3-week stay to convalesce after a knee replacement, but you're going because the home environment, it just doesn't work anymore. The average length of stay is around 1 year, give or take a couple of months. So what you're talking about is our long-term care population is generally there for a much shorter duration. We know that some 70 to 75% of deaths in many states have been in people that were residing in long-term care facilities. So when we look at that and we realize that the people that, if you will, died, so many of them, this is so sad, but they were, if you will, approaching death just through a natural order. When we start to think of it that way, then we almost want to ask ourselves a different question. We want to ask ourselves, how many actual months or years of high quality life did we lose to COVID-19? And how would that compare to the same kind of statistic or metric in 20 and 25-year-olds dying of suicide, or 30 or 35-year-olds dying of drug overdoses? I mean, I don't think that we've really done a good job of comparing apples to apples. I take care of a lot of elderly patients, and they're telling me, hey, doc, if I get COVID-19, don't worry about me. I've lived a full life. You know, and they'll tell me, my understanding is if I get it, I'll still probably be fine. But if I'm not, don't worry about me. I'm worried about the young people.
Yeah.
And I think that we've got all these nifty dashboards that are cranking up the numbers, and we've got this cases going up, and we don't even know how the CDC is counting the cases, because in some situations there'll be 4 positive tests, but they're all on the same person. And in some places, those have been counted as 4 cases. Yeah. Well, to me, that would be 1 case with multiple tests. So I really think that the take-home message in regards to testing and our, if you will, our case fatality rate and our COVID-19 death counts is we have done a miserable job of tabulating, being accurate, building the trust with the public. And so at the end of the day, we are going to have to audit. And I think we're going to have neutral people come in, because honestly, the public trust has been broken.
And I think that part of what got you in trouble when they initially reviewed you was because your comparisons to the flu and saying that, it's not really that much different. Could you speak to that? Because, I mean, most people believe that, we've dealt with the flu every flu season for my whole life, and yet we've never seen this kind of a response. Could you make some kind of comparison between this COVID-19 and our regular flu?
Thank you for asking me that, Andrew. If we look at 2009 with the swine flu pandemic, if we actually look at the death count in this country, it was not dramatic at all. But we did have probably 60 million people have the swine flu, at least if you look at the statistics. In the world, we might have had 1 billion. Now, that was 2009, and I would defy many people to tell me what they remember about that, because I don't think they remember anything, because there were no school closings, there were no lockdowns, there were no mandatory masks, those kinds of things. In 2018, just 2 years ago, we had 80,000 people die of the flu in America. People didn't even know that. So when we start to think about that, it begs the question, why with this situation, when we have COVID-19, let's say that we're at 200,000 deaths. Well, if 75% of those are in people that are very vulnerable,
well, you froze there for
50,000.
just a minute, Scott. So you were talking about if 75% of those, and that's when you froze. Could you go back to that?
Thank you. Thank you. If 75% of those 200,000 deaths this year have been in the very vulnerable, fragile, and elderly, that would mean that approximately 50,000 deaths have occurred from COVID-19 this year. And we don't know how many of those would have been in people with comorbidities such as colon cancer, breast cancer, congestive heart failure. And that's why when you start looking at that number starts to shrink. And when it shrinks, and then you compare it to 80,000 people dying in 2018, we would want to do the same kind of analysis of the 2018 death count. But I think the context starts to make us ask the questions. Why are we reacting the way we're reacting this year? Why are we telling 4-year-olds to wear a mask? Why are we telling kids that are trying to learn how to read that they're going to have to watch their teachers wear a mask, even though the teachers are trying to show kids what a vowel or a consonant sounds like and how you sound it out with lips and tongues and all that? It doesn't make a lot of sense.
And those are great, great points.
Yes. Well, the Bible says that the love of money is the root of all evil. Have you identified any financial incentives that are at work in the political/medical fields in this situation that might have something to do with this?
I remember answering that question on Laura Ingram's The Ingram Angle. And I remember the blowback was impressive, but that won't stop me from saying the same thing again.
Well, you'll probably get kudos from our crowd.
Yeah.
They're pretty radical.
Well, I remember I made a bunch of phone calls to hospital administrators. I've always had sort of a passion for understanding how it is that in healthcare we code diagnoses and we code different things. And I've given lectures around the state and also in different states in the union on coding in my medical career. And so I did have an interest in why did the Department of Health coach me to utilize COVID-19 as a diagnosis more casually than I'd ever been thought before. And so when I checked with hospital administrators, I said, what are you getting paid? Because a lot of people don't realize it, but with Medicare patients, most hospitals are paid on a bundling package where if a person is hospitalized with a garden variety pneumonia, whether they stay in the hospital 2 days or 4 days, the hospital will get about $5,000 for the care that they provided. That does not include physician fees. But in this situation with COVID-19, the CARES Act, the federal CARES Act indicated, and Medicare indicated that they would be paying if a hospital had a COVID-19 diagnosis on the discharge summary, then they would get $13,000 instead of $5,000. And if a ventilator was used, then the amount would be $39,000.
Wow.
So there was an incentive. But now when I say that, I'm not saying that hospital administrators or physicians are going to be fraudulent in coding, but I'm saying that those kinds of intersections of dollars and coding can result in a more casual approach saying, well, it could have been COVID-19. It's certainly not impossible. So that would be one area. And I was criticized on that. But then USA Today did a relatively exhaustive fact check on me. And they called me and they called people all around the country. And I remember the day where they published their findings and they said, Dr. Jensen's telling the truth. Those numbers are approximately correct. 5,000, 13,000, and 39,000.
Wow.
So I definitely felt vindicated. So to your point, Richard, no question about it. In this pandemic and in the world of medicine, sometimes to get to the bottom of things, we do need to follow the money. I know doctors don't like to hear that. But if you want to read a medical study, or if you look at a medical study and something doesn't feel right, go to the end of the study, look in the fine print, and find out who funded the study. Because that's a big deal. Because a lot of the studies are funded by pharmaceutical companies.
Well,
some of the more reputable medical journals have actually said, if you want us to publish the results of your study, then before the results are obtained, you need to register the study with us, and you have to pledge and promise that you will give us the data at the end of the study, regardless of whether it matches up with your hypothesis. And these journals did that because we know that oftentimes, if the data didn't bear out what you wanted it to, the study would get buried, and a person would go back and get funding from a different source. So I think that we do have to, in medicine, follow the money. I wish that I didn't have to give such a jaded perspective on that, but that's the way it is.
Well, but that's not true of doctors only. That's just human nature. Right. I mean, the love of money is the root of all evil. So, you could compare it to police. Not all of the police are bad, but there are some bad ones. Well, there are some doctors who I guarantee you would do things just for the money. So that's human nature. That's right.
But to that point, Andrew, I think that physicians have been guilty at times of sort of claiming the high moral ground, like they wouldn't go there. And I think that's a problem. And I think physicians need to be held accountable there. Me too, by the way, myself included. Yes, money does have an attraction and a magnetism, if you will. But sometimes physicians get inappropriately offended when someone questions their science. And that gets me to another favorite topic of mine. I think somewhere along the last 75 years, physicians have sort of indicated that they're in charge of their patients' healthcare. And I think that's a little mixed up. I think patients need to know that they can and should be their own best champion. If you want the best healthcare, you need to be your own champion. Physicians should be valuable resources. We should help you understand if a question or a decision is too complicated. Perhaps we're looking at a regimen of chemotherapy for cancer, or a tricky decision as to whether or not to have a surgery done. But the bottom line is, I'm absolutely convinced that the best healthcare is administered when patients are their own best champion, physicians walk alongside of them. I wrote a book a few years ago called Relationship Matters, and it is all about my story as a physician, that we do best as physicians when we empower and encourage patients to know that they are indeed up to the task of championing their own healthcare. So we can help.
How could a person get hold of your book if they would like to get that?
Well, they could always just call my office at 952-955-1963, and we'll ship it out from here, 952-955-1963. And if you leave your name, we'll certainly sign it. I'm not in the habit of advertising for it, but I really do think it's an important concept. And my book was written 4 years ago when there was no COVID-19. And to me, this COVID-19 underscores exactly what I was trying to say when I said relationship matters.
Well, Scott, before we go to some questions from our viewers, let me ask you this. We've shown a lot of misinformation, a lot of things, manipulation in financial incentives for misreporting things. I don't know if you can answer this, but do you think this is malicious, or did people do this solely out of fear? Or is what I would probably suspect is there are some people who know exactly what they're doing, and then they've got a lot of other people that are just following, not realizing they're being taken advantage of. What's your take on all of this misinformation?
I would say it's all of the above. I think some of it is inadvertent. I think some people have bought into one perspective so completely it is really difficult for them to break away and consider a different perspective. I think there are those that are more political activists and will go to any measure to try to get their way. I think we've seen it in political leaders where we've seen peacetime powers used to accomplish things that if normal legislative channels had been utilized, the initiative would never have been passed. Mm-hmm. But if a governor can declare an edict and said, this is what we're going to do. And by the way, there will be no judicial oversight. There will be no legislative involvement because I am saying this. So I think it's all over the map. I mean, I think that there's perverse incentives, there are unintended consequences, there's mean-spiritedness, there's delusional thinking, but it's also a lot of just benign neglect.
So last question before we go to the questions. How do you see us getting through this? Is it going to be a quick fix? Do you have any confidence in these vaccinations and things, or is this a seasonal thing that's going to reoccur? What's your opinion on that?
I think that we're going to ultimately get through this because we're going to have a composite kind of immunity develop. Some of it will be humoral immunity, which means antibodies. Some of it's already out there that we haven't even measured, and it's cellular immunity, the kind of immunity that would help us, if you will, fight off tuberculosis. There's also the issue of disease resistance. Oftentimes we hear of leprosy in the days of Jesus, but one might wonder, how come it wasn't more of an epidemic at that time? And actually, we know now that probably 90% of the population was resistant to the leprosy disease and probably couldn't have gotten it even if they would have put it on their Cheerios in the morning. So you put all of those things together, and I think we're going to get through this through herd immunity. Now, vaccines allow us to get a passive immunity by obtaining a vaccine, but whether or not we get to where we want to get in terms of safety and efficacy, that remains to be seen. If you actually look at our track record with respiratory viruses, RNA respiratory viruses, where we really get to where we want to get with a highly efficacious, potent vaccine that does the job, we don't have that good a track record. So to me, the idea that we're trying to squash the case number as low as possible, just waiting for that vaccine, doesn't make a lot of sense. I think that we can have kids in school. I think when you calculate the case fatality rate and the infectious fatality rate for people under the age of 30, statistically, it's practically zero. So from my perspective, how are we going to get through this? We're going to have a lot of discussion on the vaccine. I think once we're past the election, I think we're going to see a lot of the sensationalism sort of back off a little bit. But ultimately, by having people develop immunity, and at some point in time, getting to the necessary level of herd immunity through different mechanisms is how we're going to do it. And we will do it. So this is not an existential crisis.
I said last question, but here's another last question. Yeah. You know, I'm a preacher. Paul did this. He said, finally, brethren, and then he preached 3 more chapters. But here's hopefully my last question is, what was my last? I was given that. It was a good question.
About the politics, probably.
No. Oh, well. It was a good question. Well, it'll come back to me like a skunk when the wind changed. It'll all come back. Have we got some questions, Richard?
Oh, we sure do, Andrew. Some good ones here. This one is coming in from an unnamed guest, but this person asks, what are the long-term consequences from COVID? And I understand from this that they're really asking, what are the long-term consequences from how we've handled COVID as a society and as a culture?
That's a great question. I'd probably say 3-part answer. First, I think that the public trust has been broken, and we're going to be a more suspicious people when it comes to trusting bureaucrats, epidemiologists, and we're going to have to find a way to rebuild that public trust. 2, I think the medical community is going to have to try to walk it back and say, we have got to be more scientifically based. We cannot have physicians bickering and warring with one another simply because they have legitimate different viewpoints. And thirdly, we are going to see, and it's going to be tragic, we're going to see a memory of 2 populations that have been powerfully and adversely affected. One will be our long-term care folks. These people died alone. They died alone because they got a disease that we created a pipeline right into their facility where they lived, right into their home. We had policies made where it was almost a likelihood that they would get the disease. But when they got the disease, their loved ones couldn't visit them, they couldn't leave, and they died alone. Tragic. The other group of people that we have harmed, and it'll be more difficult to see it, will be the children. We know in psychology today that adverse childhood experiences have a lot to do with what causes a 10-year-old to be, if you will, struggling with mental health. What causes a 15-year-old to think about suicide? What causes a 20-year-old to become an alcoholic? What causes a 25-year-old to become a drug addict? We are going to see more of this because of what we did to the 3 to 7-year-old population. You cannot take kids and tell them for 8 or 9 or 12 or 15 months, we are going to brutalize your experience of life as you have seen it. When we're talking about that, we're talking about kids don't remember a lot from 0 to 1, but from 1 to 5, there's a lot of formulative notions going on in their head, and they don't necessarily recall it, but it's there. And we've really done a bad thing.
Man, that is a great answer.
That is
very
phenomenal. We
insightful.
need to print that and distribute it.
That's right.
You know, I have a follow-up question for you, Scott, which is what damage has been done by politicizing medicine?
I'm going to go back to trust. I think that, and yet I want to not be a jaded cynic. I'd rather be a naive optimist. So I'm going to say one. I think trust has been fractured, but with that fracture, I think there's enough voices, such as both of yours, Richard and Andrew, and I hope that mine contributes as well. But there's enough voice out there that will tell people, you're up to the task. You don't need to bow down and genuflect to your physician's suggestions or recommendations. If you don't feel like the medication that the physician is recommending fits with your own approach, that you would rather go it naturally, you'd rather try some zinc and some vitamin C and some vitamin D, you'd rather lose the 5 to 10 pounds, you'd rather start taking the walk every day for at least 5 or 10 minutes and grow the walk from there. I think there's a very sound rationale for us to be hopeful that maybe this is a time that we needed to pivot, and we need to pivot away from the command expertise that physicians or the healthcare industry insists on, where patients can start being in charge. I know it's going to be difficult because health insurance is so expensive. So we're going to probably see a schizoid medical system. We're going to see patients very strongly saying, for my day-to-day healthcare needs, for the things and the questions I have, I'm going to have a relationship with someone that I trust, that I believe in will advocate for me. But we're probably going to have to live with less of a personal approach to some of those big ticket items that require emergency hospitalization, such as an appendectomy, a heart attack, a stroke, or a cancer diagnosis. In those situations, in order to control the costs, we're probably not going to be able to make as much advance forward. We're probably going to see insurance companies and payers and large clinics and systems have a lot to do with, okay, this is the algorithm we'll follow. And with that will come a danger that there will be a bit of a cookie cutter approach. But in terms of trying to control the exorbitant costs of healthcare, we're probably going to have, if you will, a bimodal system of healthcare.
That's amazing.
Yeah,
Very
it
good.
is. Well, here's we have a lot of questions about vaccines and a lot of questions back on the subject of the financial incentive that we talked about earlier. But on the subject of vaccines, Doctor, we do have someone who's asking if the vaccine will contain aborted fetal tissue like other vaccines. Do you have any thoughts on that?
One word: choice. It has to be a choice. Parents choose for their children. Adults choose for themselves. I don't see it any other way. A vaccine is not a shot of penicillin in your butt because you got strep throat. A vaccine is like it's an intervention. When we do something surgically, we go in and try to cut out the gallbladder because we don't want to get the common bile duct plugged up anymore so that a person can live normally again. That's an intervention. If we do chemotherapy for someone with cancer, we're injecting something into their system, and we hope that we'll get a better kill rate of the cancer cells than of the person's own cells. And the same thing can be said of a vaccine. We are literally introducing an agent into a person's body, and we're expecting and hoping to evoke an immune response that will provide a level of protection against that disease. It is not an automatic. In 1976, when President Jerry Ford got his swine flu vaccine, I remember the pictures in the newspapers that were, I think he got it in his left upper arm. And I remember they were all so proud. Well, within 2 months, that vaccine program was suspended because of the number of Guillain-Barré cases that were popping up. And it was never restarted again. Vaccines have risks. And we've allowed pharmacology and pharmaceutical companies to create vaccines with a tremendous amount of indemnification and protection. So I don't see how we can think rationally that we can have, as a state, force people into taking a vaccine they don't want to take. That is not American. That sounds like the Cold War.
Mm-hmm. Well, I can understand why you've been criticized. You are not saying the politically correct stuff, but I love it. And I can guarantee you the people watching this love it too. It's
Absolutely. Well, I have a question, Doctor, which is like, are you seeing any uprising, if you will, inside of the medical community on the restrictions on free speech that you've experienced, the blocking of access to hydroxychloroquine and the other medications? What are doctors saying when they are together in private about this whole situation?
This is a great sadness for me. I'm disappointed in my profession. I feel that we're seeing a little bit of a schism between one group of physicians and the other, and I am afraid that I am in the minority. That disappoints me greatly. My children are fully vaccinated because my wife and I chose to do that. And when I say fully vaccinated, I'm talking about the recommended ones, but there were certainly vaccines we didn't choose to use, but we did that because of choice. I feel like today there are many physicians. Actually, I read an article over the weekend. More than 50% of the pediatric clinics that responded to a survey have a policy that if you don't go along with their vaccination schedule, they'll dismiss you as a patient. This is astonishing to me. I do not believe that I have been given the privilege of caring for people and serving people so that I could make decisions that harshly and tell someone, I may have taken care of you for a long time. You may trust me, but I am not going to allow you to be a patient in my clinic because you're not going along with our vaccine protocol. These are the kinds of things that really trouble me about my profession. And I think that we should have had a broad uprising. Actually, the physician's behavior on this reminds me a little bit of Martin Niemöller when he made that famous quote after World War II, where he said, when they came for this group of people, I didn't protest because it wasn't me. And when they came for this group of people, I didn't protest because I wasn't in it. And when they came for this group of people, I didn't protest. But when they came for me, there was nobody left to protest. I sort of feel like, even as a physician, even if you don't agree with me, I don't think it's a bad idea to at least stand up for the intellectual, scientific curiosity that we've always been about, at least in my lifetime in medicine. We do grand rounds, not so we can get together, pat each other on the back and sing Kumbaya. We do grand rounds because we want to purposely, robustly, inquisitively interrogate one another. How do we get the best treatment protocol for this person with this cancer? What does this person's medical diagnosis most likely fit with? This is who we have been. But I have seen physicians just ridicule one another because one person's perspective is not the same as the other's. We're not as scientifically based. Physicians have become political.
And you know, this goes far beyond medicine too, because for a long time now, the liberal left has been pushing for new liberties and freedom and sexuality and all kinds of things, socialism and on it goes. And they say tolerance, but it's gotten to where if you disagree with them, they do not tolerate any disagreement. People are being fired from their jobs because they just say something that's a little bit politically incorrect. And that's affecting medicine, the things that you're talking about. You can't voice a different opinion because they call it hate speech or whatever, and they come against you.
I think healthcare, being a doctor, has moved. And I know there'll be a lot of people that'll be inflamed by my comment here, but I didn't mind growing up in a time when there was this guy named Marcus Welby who modeled what a physician might be for both himself, for the field of medicine, but for his patients. To me, Marcus Welby always sort of gave us a sense that he felt called to be a doctor. He felt that the core thing that he did as a doctor was serve. I don't think that's where we're at today.
That's a shame. And I'm sure those of you, one of my board members is a leading surgeon in Shreveport, Louisiana, and I know his heart too. And those of you who are in the medical profession, because you really want to make a difference, like you told us before the broadcast started that you were actually in seminary one time, but you went into medicine because you thought you could minister to people. And I'm sure it's breaks your heart to see the way that you are restricted and held back from doing things that could really benefit people.
I know that I'm generalizing, and so I don't want to throw all the physicians in one bucket. I understand that. But if I could just comment on, Andrew, what you said. Yes, that is why I went into medicine, was because I had a passion for science and chemistry, and I liked people, and I wanted to help. A question that I've been asked, and you had mentioned this earlier before we started the broadcast, was going into the Senate. What pushed me there? And in the end, there were 3 verses that really came home for me in terms of why I decided to give the Senate a run. And every one of the verses comes from a book in which the verse I look at is chapter 4, verse 14. It's Esther, it's John, and it's Hebrews. And in Esther 4:14, Mordecai throws a challenge out to Esther and says, have you thought that you're in the position you're in for such a time as this? Mm-hmm. And that really struck my heart when in 2015, my wife and I decided to run. The next one, you jump to John 4:14, and Jesus says, whoever drinks of the water I give him will never thirst, for the water I give him will become in him a spring of water welling up to eternal life. And I sort of felt like it was my time to find where that spring of water was leading me to. What kind of a life was I supposed to live? Was I supposed to move beyond the spring of water just in terms of medicine? And then in Hebrews, it says that because we have a great God, a great Savior, that we should hold fast to the faith we profess. And those were the 3 key things that said, okay, I'm going to run for the Senate. And without those 3 guideposts, I think that my time in the Senate would have been far less satisfying and valuable. But because those things did sort of serve as my guideposts along my path, I've certainly enjoyed serving in the Senate, and I enjoyed meeting so many constituents and trying to help.
Scott, I'm going to have to break in because we're only 30 seconds away from the end of our broadcast. Thanks to CTN for broadcasting this, and we want to honor their time restraints. But Scott, you've been a blessing. I can guarantee you a lot of people have received from this. We will have information on our Truth and Liberty website about how you can go to his Facebook page and communicate with him, how you could get that book if you so desire. And remember that we do this every Monday night at 6 p.m. Mountain Time. And I tell you, we have a lot of good things. This was awesome tonight. Thank you so much, Scott. And God bless all of you who watch. God bless you. We'll see you next week.
Join us next time for the Truth and Liberty broadcast. Find tonight's episode and related articles and links at truthandliberty.net. Truth and Liberty is viewer supported. If you'd like to help us continue our live casts, you can make a donation at truthandliberty.net.